In this video, we're going to discuss the endoscopic discectomy. My name is Dr. Pablo Pazmino. I can be found online at spinecal.com. These are some of the hospitals where I'm on medical staff. What we've been seeing lately is that patients are now traveling from the South, from the Midwest, and even internationally to have us perform their procedure here at the Spinecal Institute. Let's take a moment to focus on the endoscopic instrumentation itself. Here's a surgical endoscope I use during surgery, and you can see at its tip it's very small, almost as thick as a pen or pencil. Let's look from the back of the endoscope. Here's where you can see the camera inserts, and it's looking down the lens of the scope itself. Now let's take a look at the other side of the camera where the tip is. Here you can see by the red arrow, that's the actual lens of the camera, which magnifies on the screen for me. This blue arrow shows you where the water comes out during the entire procedure and bathes the nerves and the disc herniation itself. And finally, this yellow arrow shows you the open port where I pass the instruments to remove the disc herniation and pressure along the nerves. Here's a different selection of all the instruments I can put inside that portal hole to remove the disc herniation. If you look at these instruments up close, they all have these kind of little biter teeth that help me pluck out the disc herniation right off your nerves. Now let's take a look at what it looks like during the actual surgery. Now, as I mentioned, we initially start with a pen-sized incision, very small. So here's the pen that we first put inside. This is what it looks like when it's placed under the X-ray, and that's how we monitor exactly where the camera gets placed. And here's the camera itself. You can see the camera is attached now to the water and to the screen for me to visualize. Now on the screen, this is what I'm seeing during surgery. As the endoscopic camera shows me, the disc looks very torn and ratty, and as we remove the herniation, you can see the hole where the disc herniation once was. But now, let's look at a patient who just had the surgery.
Discectomy, primarily to preserve the shape of the vertebrae for full support in case I needed to have another secondary procedure later on, like a disc replacement. And it actually turned out really well. Very small surgical scars, very fast healing time. It's pretty much the way to go.
Good. Can we see your incision?
Absolutely.
Okay, great. And then where was your pain kind of before surgery, and which leg?
Before surgery, it was actually running down both legs, predominantly the left leg, shooting pain all the way down through my feet.
Okay.
And immediately after surgery, that was gone.
Okay.
Thanks to Dr. Pazmino.
Okay.
Magic fingers and magic equipment.
Okay. Thanks. And here's that same patient for his 3-week post-operative visit.
It's been about 3 weeks since Dr. Pazmino did my L4, L5 microdiscectomy with primarily foraminal approach. And honestly, the pain has been relatively mild. I'd say post-surgical I used some heavy medications for the first week. Second week I pretty much took nothing from there on out, just some muscle relaxers. And occasional spasm, but other than that, everything feels great. Everything's recovering very quickly.
Great.
I'm impressed.
Great. And then we did your surgery endoscopically, and you were in the hospital, actually in the outpatient center. We did it outpatient, so you went home the same day?
Yes.
Okay. If you enjoyed that short video on endoscopic discectomy, because of demand, we've had to expand to 3 offices to serve the entire Southern California basin. Here's our main hub in Santa Monica. We're also seeing patients in Glendale, and here's the office phone number to schedule a meeting there. And finally, here's our office address and phone number in Long Beach. If you or someone you know could benefit from an endoscopic discectomy or other spinal procedure, feel free to contact us. We have a 1-800 number, a direct line, a website, and also a direct email.